One more, assembly members. One more.
Water okay? You doing okay there?
We're doing good here.
Okay, all right.
I think this is my last one in health committee for the year. So see you again after next year. I want to again thank Mr. Chair. You and I have had conversations on this. The committee has had several meetings with my team on this. I want to thank you all for your diligent work on getting to a place we can move forward, hopefully. I will be accepting the committee amendments as described on page 9 of the committee analysis. SB 729 would require large group health plans to provide coverage for fertility care, including treatment for infertility and IVF. We're seeing that 1 in 8 opposite-sex couples will be struggling with infertility, and that ratio does not even include any of the unique family-building challenges faced by myself and my family and the rest of the LGBTQ plus couples. Data from the Pew Research Center indicates that a full third of Americans have used fertility health services or know someone who has. I definitely know several of my friends who have. Yet right now, the safest and most reliable methods of fertility care remain out of reach for most Californians because it's really expensive. Current law mandates only that health insurance offer coverage for treatment of infertility, but it does not require that all plans actually provide coverage. Additionally, current law requires invasive standards of proof in order to access care. For example, you have to prove that you have completed a year of heterosexual relations without contraception, which are standards that me and the rest of the LGBTQ, most of the LGBTQ couples are often unable to meet. Worse yet, the law explicitly excludes any coverage of IVF, even though that's the most reliable treatment within up to 77% of success rate. For Californians struggling with infertility, the very existence of the family they hope to build can depend on income alone. Now, I recognize that this bill is, again, not something that is, if should this pass and gets a signature, where we stop. There is so much room to move on, to grow on, but this is a way to ensure the conversation gets started. But I know you're in this committee have heard this bill before from one of your colleagues in the other house. So the conversation has started. I'm looking to ensure that it continues going. We want to ensure that we're increasing access to care, help reduce inequities in health and economic status, and bring the law up to date on medical advancements in IVF and its uses. As a reproductive freedom state, California still has significant work to do. I will always be the first person at the front line to protect someone's right to choose to have a child, but I'm always going to be at the front line as well to help an individual have a child should they wish to as well. 14 other states have already passed IVF insurance laws, and we must catch up to continue to earn our designation as reproductive freedom state. To that, I'd like to turn over to Mallory Casperson, the CEO, co-founder of Cactus Cancer Society, who brings firsthand experience, followed by Dr. Ruben Alvero, a professor of obstetrics and gynecology at Stanford University.
Hello, my name is Mallory Casperson, and I live in Berkeley, California, with my husband, Brett, our 3.5-year-old son, Tennyson, and our rescue dog, Lulu. When I was 24 years old, 2 months after my mother passed away from a brain tumor, I was diagnosed with Hodgkin's lymphoma. I was engaged to be married in a master's program in aerospace engineering, mourning my mom, and suddenly facing a life-threatening diagnosis. I underwent months of chemotherapy treatment and was deemed cancer-free, but long-term side effects caused me to leave my PhD program. I spent a year talking with other young survivors and ultimately founded a nonprofit to support them called Cactus Cancer Society. When I was first diagnosed with cancer, I entered treatment quickly and did not undergo fertility preservation. I was young, and the treatment I underwent on a clinical trial was relatively low risk to my fertility. 8 years later, and after more than 18 months of actively trying, I had my son. When he was 1 year old, my spouse and I started trying for another child, but I noticed hardened lymph nodes in my neck. Just shy of my 10-year cancer-free anniversary, my cancer had returned. I was now 34 years old and terrified that I would die with a husband and a baby at home. I decided again to immediately start chemotherapy. Now, after 2 cancer diagnoses, 10 years apart, my ability to conceive has been severely compromised. I chose not Thanks. I chose not to preserve my fertility in order to expedite my life-saving treatments and am now paying for costly IVF treatments. This is full service. With very limited fertility coverage. Through my experience and through my work, I know how painful and difficult it is to lose your fertility because of cancer. Young people facing cancer want to live, but surviving is not enough. We want to lead active and productive lives, and many of us want to have children. My son is rambunctious, and he loves Legos. And I'm beyond lucky to have him, but I want to have another child. SB 729 would help those who, now because of SB 600, were able to undergo fertility preservation, realize the promise of their carefully stored materials. And it would also help patients like me who couldn't preserve by providing for the medical interventions they need after surviving cancer. We already face daunting obstacles to realizing the dream of a family. The risk of recurrence, the challenge of long-term physical and emotional side effects, the possibility of dying too young, the burden of having to pay the substantial out-of-pocket cost of IVF, which are not feasible for many, does not need to be included in this list. On behalf of young cancer survivors like me and all Californians who are facing or may one day face infertility, I respectfully ask that you support SB 729 to bring more equitable and comprehensive infertility coverage to all Californians who need it. Thank you.
Thank you very much.
Good afternoon, members. My name is Dr. Ruben Alvaro, and I am a professor and division director of reproductive endocrinology and infertility at Stanford University and Stanford Medical School. I'm also a retired U.S. Army colonel with a 27-year career, with a significant portion of that time serving the fertility needs of active duty service members and their partners. Infertility is indeed a disease, not unlike diabetes and cancer, and profoundly affects the quality of life of those affected, including 1 in 7 Californians of reproductive age. Both the World Health Organization and the American Medical Association have long held this view, citing the millions of people worldwide who are impacted by this condition. And quality of care unequivocally has been shown to be effective in treating the condition in most cases. Unfortunately, there's unequal access to quality fertility care, since even in the most affluent country in the world, only 14 states have some mandate for insurance coverage. Unfortunately, California is not one of those states. Prior to coming to California, I practiced in Rhode Island, which has a mandate. And I had the privilege of caring for fishermen, for bus drivers, for teachers, for cops, for firemen, and just every member of the community that you can think of. At Walter Reed, I cared for all ranks equally, including enlisted, non-commissioned officers, company grade, field grade, and even general officers, all without regard to cost. As a native Spanish speaker, I am used to serving the Hispanic community, and usually about a third of my patients are Spanish speaking. Sadly, given the absence of a mandate in California, I speak very little Spanish in my clinic these days. Fertility costs have been shown to be cost effective in multiple journals and in the states with a mandate. Estimates for the price of a single birth generally range from $25,000 to $30,000 per live birth, which is exceptionally good in the cost effectiveness world. Additionally, mandates have been shown to incentivize the use of safer approaches, such as transferring only a single embryo. This improves outcomes and reduces costs. When you practice in these mandated settings, individuals can focus on their reproductive journey rather than being distracted and worried about what their treatments will cost. Absence of coverage encourages dangerous practices which increase multiple pregnancies, which have significant costs for the medical system and also for the state. Fertility services are considered the standard of care in any community and are part of a continuum from pre-pregnancy to neonatal care. California should join those states and medical systems that have chosen to do the right thing. I ask that you support Senate Bill 729. Thank you.
Thank you very much. Others in support, please?
Hello, Karen Stott on behalf of NARA Pro-Choice California, proud sponsor of the bill, as well as the California Nurse Midwives Association, in strong support.
Thank you.
Hi, Joyce Reinecke on behalf of the Alliance for Fertility Preservation and here on behalf of Resolve, the National Infertility Association, supporting the bill. Thank you.
Thank you.
Rebecca Gonzalez, National Association of Social Workers, California chapter in support.
Thank you.
Greg Pulsfer on behalf of Equality California, proud co-sponsor and strong support.
Thank you.
Jennifer Robles with Health Access California in support.
Thank you.
Beth Malinowski with SEO California in support.
Thank you.
Jennifer Snyder with Capital Advocacy on behalf of the California Life Sciences in support.
Thank you.
Alice Kessler on behalf of the Academy of California Adoption, ART, Assisted Reproductive Technology Lawyers in support.
Thank you.
Noah Bartelt on behalf of ACLU California Action in support. Thank you.
Thank you.
Molly Robeson with Planned Parenthood Affiliates of California in support.
Thank you.
Josephine Figueroa on behalf of Insurance Commissioner Carrillo, proud co-sponsor and support.
Thank you. Is there opposition to the bill? Remind we have 2 witnesses.
Hello, my name is Allie Snyder, mother of 2. No one has the right to buy a baby. SB 729 redefines infertility to a person's inability to reproduce either as an individual or with their partner without medical intervention. This is obviously insane. Humans need 2 gametes to reproduce, sperm and eggs. Individuals have only one or the other, so no one can reproduce without a person of the opposite sex. Under SB 729, everyone will be considered infertile and eligible for surrogacy. California obviously doesn't care about women. After all, it houses convicted rapists in women's prisons under SB 132. Still, it should be noted, destitute women's bodies will be broken by the increased demand for babies. Let's be explicit in who will be eligible for a baby. I'll focus on 2 protected characteristics, age and disability. The state legislature thinks kids as young as 12 can emancipate themselves under AB 665. Does it follow they're mature enough to have a baby? How about the elderly? Using IVF, Dr. Sahakian helped a woman give birth to twins at age 67. She died of cancer a year later, leaving her twins orphans. How about someone with a disability, such as an acute mental illness? Maybe an autogynephile with a breastfeeding fetish. Propagandists say these men are loving parents, just nursing their infants, but these very same men post pictures of themselves enjoying nipple clamps and masturbating while using breast pumps. There's a word for men who force children to suck on them. It is not mother. Babies are blessings, too many of whom already suffered the primal trauma of losing their mother. They need loving families. SB 729 will make California complicit in this trauma, complicit in buying babies, and potentially complicit in giving them to predators. Vote no on SB 729.
Thank you, Mr. Chair and committee members. From the California Chamber of Commerce here today.
I don't know
No mic.
There we go.
Better? All right. Preston Young from the California Chamber of Commerce here today in opposition to SB 729. As I've said in previous committee hearings and made clear, it is not a policy issue for us. That is not why we're here today in opposition. It's the unintended consequences that come along with SB 729 that we're concerned about. Notably, the costs associated with SB 729, if this bill goes into effect, is the reason for our opposition today. Now, the California Health Benefits Review Program conducted an analysis of SB 729, and they determined that if the bill went into effect with the way it appears in print today, it would increase premiums for California employers and employees over $330 million. I appreciate the author and the committee's work on this. I appreciate the amendments that have been agreed to. And putting a cap on the IVF treatment is a step in the right direction. However, this is still an extremely large expense for California's employers and employees. When we look at this in isolation, I understand it seems like it's something that is worth it. It seems like policy that we should implement because it is going towards individuals starting a family. However, we have to put this into context. Healthcare affordability as a whole right now is increasing every year. Additional mandates will be passed through by this legislature, which will increase costs. Additionally, there's inflationary pressures in the economy right now, pharmaceutical cost increases and point-of-care cost increases. Furthermore, to put it in greater context, over the last 5 years, the average premium for family coverage in employer-sponsored plans has increased 20%. In 2022, the average annual premiums for California employer-sponsored family healthcare coverage reached $22,463. Workers on average paid $6,106 towards the cost of that coverage. So as I said at the beginning, we need to keep this in context. I understand the policy. I understand what is being driven towards here. It's the unintended consequences that we're concerned about, and I thank you very much for your time and your consideration.
Okay, thank you very much. Others in opposition?
Mr. Chair and members of the committee, Jed Hampton with the California Association of Health Plans, here regrettably in opposition. I would align my comments with Mr. Young's comments. We are concerned about the cost of this particular mandate. Thank you.
Thank you.
Mr. Chair and members, John Winger on behalf of America's Health Insurance Plans would also align our comments with the Chamber related to the cost.
Okay, thank you.
Stephanie Watkins on behalf of the Association of California Life and Health Insurance Companies would echo my colleagues' comments with the Chamber. Thank you.
Thank you.
Nicole Young, Placer County, opposed.
Okay, thank you.
Nicole Pearson in strong opposition. Thank
you.
Max Bonilla in strong opposition.
Thank you.
Cheyenne Kenny in opposition.
Thank you.
Elizabeth Kenny, opposition.
Thank you.
Greg Burt with the California Family Council in opposition.
Okay, thank you.
Mrs. G, and I oppose.
Thank you. Anyone else? Okay, seeing no one, we'll bring it back to the committee. Questions or comments? Dr. Weber?
I first want to thank both of your witnesses, but specifically the patient for relaying your story. I, too, have a family member who was diagnosed with non-Hodgkin's lymphoma when he was 19. That was almost a little over 20 years ago. Unfortunately, there was no thought or consideration to future fertility, and the thought was to go straight to chemotherapy. And, he was hit with some very, very strong chemotherapy and is unfortunately infertile at this point. So thank you very much for sharing your story. Infertility, to my fellow colleague, is a disease. And I know it's been taken out of this bill, but it is. And it is a condition that we should treat and give as much focus and attention to as we do other diseases or conditions. There are a couple of things that people said. One, Senator, I think you said you wanted to reduce inequities within the healthcare system. And my fellow physician talked about the fact that in certain states and in certain areas where you practice, you were able to give care for every member of the community and not have unequal access. My concern with this bill is that it does not give equal access to everyone. And Senator, you and I have talked about this. It explicitly eliminates the people who need it the most, and that's our patients on Medi-Cal. And, there are times, because these treatments are so expensive, that people with insurance have to decide between using the money for a down payment of a home or pay for these treatments. But when we look at our most vulnerable in the Medi-Cal population, that's not even an option for them because they don't have money for either one. And although we say, okay, we'll work here, we'll chip slowly at this until we can get to a point where we cover everyone, one of the things that we have noticed is that those are the people that are often left behind first. We will eventually get to you. We will make sure that we're working on education in this space, and eventually we'll get over to this area to improve educational outcomes for people in other areas. We will deal with environmental issues over here, and then eventually come over and work with you all. We will make sure that we have the best and the brightest and the biggest hospitals over in this area that take commercial insurance, and over here we'll get to you at some point. And all that has done is created continued disparity between the haves and the have-nots. I believe that this is something that should be covered for everyone. And if we're going to start someplace, I believe that we should start at a place for those that need it the most, that do not have the ability to choose between paying for a down payment on a house or a down payment on a car or this particular treatment. And so this bill, as it stands, to me, sets up inequities between the haves and the have-nots, who will get covered based on your insurance and who won't get covered because you happen to be on Medi-Cal. And for this particular bill, as is, for that reason, I cannot support it. We talked about, my background. I did my OBGYN residency at Cook County Hospital in Chicago. And when it came to issues of family planning, if someone had had their tubes tied and they didn't have insurance and they had to come and see us at Cook County, the only option that we had for them was to actually do surgery, open them up, and re-anastomose their tubes. If they had insurance and they had had their tubes tied and they wanted to now have a baby, they had the ability to go across the street to Rush and get IVF. That bothered me back then, 20 years ago. And I felt that way when I read this bill. So I really applaud your effort for continuing the conversation. I hope that you continue down this road and not forget the people who, regardless of what community, because we have minorities that are on Medi-Cal, we have LGBTQ plus people who are on Medi-Cal, we have a wide variety of our patient population that is on Medi-Cal that do deserve to have the best health care options, just like those with commercial insurance. So I hope that you continue the conversation, and when that bill comes forward, I would gratefully support it. But this particular bill, I cannot support today. Thank you.
Any other members? Okay, seeing no one. The bill enjoys a do pass recommendation. Senator, would you like to close?
Thank you, Mr. Chair. And I'll address a couple of things. If you look at probably not. My legislative package this year has to do with uplifting our most vulnerable individuals. You described two demographics that make up who I am, Dr. Weber: LGBTQ, minority. Medi-Cal recipients make up my family. I am no stranger to ensuring that whatever we pass is helping. I don't know if motion sensor.
It's impressive.
is going to be reaching every single individual. At the same time, I'm also as chair of Budget Sub 1 in the Senate of Health and Human Services, have dived into all the money, into this budget deficit, and I was realistic in seeing what I can move forward, if that. The bill from your colleagues, I believe last or 2 years ago, didn't make it out of the first house. This is the furthest this kind of bill has gone. And I know that this is no way a one and done. But to say that because not everyone can get it right now, to not support it, it's going to be hard for me to agree with that. But I would always say yes to providing services to every single individual. To the expense, CHPERB made their analysis, but I would note that their number also includes postpartum services that are already covered by the state of California. So that large number includes from pregnancy to postpartum. There has been another review from an industry leader in fertility data analytics that shows that it will be a 0.72 cent per member per month to cover the 9 million insurance plan enrollees with insurance subject to these requirements. Additionally, a 2021 Mercer survey of more than 450 employers nationwide found that 97% of those employers offering infertility coverage, even those with IVF, did not experience increases in their medical costs. And these are from the states that already offer this kind of care. This is a needed, much needed first step in the right direction to ensure individuals like you heard of my first witness, to ensure individuals like me, that even with a Senate pay, it's still very expensive for me and my wife to go through IVF. It's a step in the right direction. And if you allow me to move in that right direction, moving it out of this committee, I do promise, like I shared with Dr. Weber, that I won't stop here. I will ensure that every single individual gets covered for infertility. With that, respectfully ask for your aye vote.
Thank you very much, Senator. Is there a motion? There's a motion by Ms. Aguiar-Curry, a second by Ms. Carrillo. The motion is do pass as amended to appropriations. Madam Secretary, please call the roll.
Wood?
Aye.
Wood, aye. Waldron? Waldron, aye. Aguiar-Curry? Aguiar-Curry, aye. Arambula? Boerner? Wendy Carrillo? Wendy Carrillo, aye. Flora? Vince Vaughn? Maienschein? McCarty? Joe Patterson? Rodriguez? Rodriguez, aye. Santiago? Villapudua? Weber? Weber not voting.
You have 5 votes. We'll leave the bill on call.
Thank you for spending the afternoon with me.
Thank you, Senator.